Welcome to this comprehensive overview of the changes to Medicare Part D in 2025. 2025 has brought significant changes to Medicare Part D. Understanding these changes is crucial for healthcare professionals to better serve and inform providers and Medicare beneficiaries about their coverage. Let's dive into what's new. Out-of-pocket cap. Starting January 1st, 2025, there will be a $2,000 annual cap on out-of-pocket costs for Part D covered drugs. This cap means that once a beneficiary's out-of-pocket expenses reach this amount, they will pay nothing more for their medications for the rest of the year. Elimination of the coverage gap, the donut hole, will be completely removed, simplifying the coverage structure to only 3 phases: deductible, initial coverage, and catastrophic. Let's take a deeper dive into the differences. For 2025, the Medicare Part D deductible has gone up to $590, marking an increase from the $545 set in 2024. In 2025, Medicare Part D enrollees pay 25% of drug costs in the initial coverage phase, with health insurers covering 65% for applicable drugs and 75% for others, differing from the $5,030 coverage limit in 2024. In 2025, after $2,000 out-of-pocket, enrollees enter catastrophic coverage, paying nothing for covered drugs, with health insurers covering 60% compared to $8,000 in 2024. Beneficiaries can now opt into a program that allows them to spread their out-of-pocket costs over monthly payments rather than paying large amounts at the pharmacy. This is called smoothing and can significantly ease the financial burden at the start of treatment. These changes will directly impact how patients manage their prescription costs. Patients with high-cost medications will benefit from the $2,000 cap, ensuring they don't exceed this amount in any given year. The removal of the coverage gap phase simplifies how much patients will pay throughout the year, making it easier to predict costs. And the new payment plan can help patients manage cash flow better, particularly those on fixed incomes. Let's look at some practical scenarios. Example 1. John, diagnosed with stage 3 lung cancer, faces high osimertinib costs in 2024, with a coverage gap and $8,000 out-of-pocket max. But in 2025, new Medicare Part D rules cap his out-of-pocket at $2,000. Eliminating the coverage gap and offering monthly payment options, significantly easing his financial burden. Example 2. Sarah, a breast cancer survivor using abemaciclib, sees her costs shift. In 2025, her out-of-pocket max is $2,000, with no coverage gap and monthly payment options. In 2024, she faced high costs, a coverage gap, and an $8,000 limit. In conclusion, the 2025 changes to Medicare Part D are aimed to make prescription drugs more affordable and manageable for beneficiaries. As concerned professionals, staying informed and adaptable to these changes will ensure the best support for cancer patients. For more information, or if you have questions, you can refer to the Oncology Library of Modulettes and our learning and development tools, or reach out to our team.